We've got about 10 minutes, and I'm open for questions. What's in a placebo? Do you know? That's an excellent question. They usually don't say. They usually don't say. It can be cornstarch. It can be, when it's an injection, it's usually saline. It should be innocuous. There are some cases when you give, it can be lactose, which is fine, I guess, for some things, but imagine if you're doing it for gut disorders, a treatment for gut disorders, and you have some people who are lactose intolerant and the placebo has lactose. That'll give you a drug-placebo difference, won't it? So it should be required that people state what was in the placebo. That's a good, excellent question.
Hi, I'm over here in the middle.
Oh, yes.
Hi. Later on, next session, you're going to be talking about pharmaceuticals in general, not necessarily psychiatric ones.
Yes.
And my question is to the medications prescribed for epilepsy, like Lamictal and phenobarbital. What do you think about those?
What I have to say is come to the next session and ask one of the other panelists, because I have no idea. I haven't studied those data. And one of the things that I am very careful about, I need to be very careful about, is not to make any claims or evaluations unless I have studied the data well enough to feel that I can do so with confidence based on data, not based on my guess or what I've read casually. When I say something here, I want you to know that it is based on a careful and thorough evaluation of the data that I can back up easily and quickly. When I did that, I was very impressed, I have to say, with 60 Minutes. There was a year preparing that story, and they did their homework. I've been interviewed for a lot of television documentaries and news shows, and I've never seen anything like this before or since. They were on the phone with me about once a week before the interview, and they would say things. Look, we just saw there's this new study out, and it seems to say this. Have you seen it? What do you think of that? And so-and-so from the FDA has said this to us. What do you think of that? And they would go back to the FDA. Kirsch said this. What do you think of that? And after they finished filming, until it aired, from the time they finished filming to the time it aired, every few weeks, I'd get a phone call from them. Some new data, some new studies been published. They wanted to make sure that they could defend the statements that they made and the way they put the program together. They aired the program. The former head of the American Psychiatric Association made a statement saying it was irresponsible of them to have aired that segment, that Kirsch's research has been discredited. He didn't say by whom or where. And the 60 Minutes replied, we stand by our story. So I was very impressed by them.
I want to thank you for such a great presentation in demonstrating, without a doubt, the placebo effect. But have you looked at, or anyone looking at, how does the placebo effect work? What is the workings of it? Is it worked on a belief system and thought? So there's other processes going on here that I feel that they're the ones, since the placebo effect is so good, why don't we find out actually how it works and make it work?
Absolutely, and that's why I've been doing research on the placebo effect before I ever got into the field of antidepressants. I'm associate director of a group at Harvard called the Program in Placebo Studies, and we are devoted to doing exactly that, to trying to take apart the placebo to understand how it works, and we are learning tremendous amount. One thing we're learning is that it's not just one placebo effect. There are many different placebo effects, and they work differently. So the way we do brain imaging studies, for example, the way a placebo works for depression is different than the way it works for pain. And even within the same disorder, placebo morphine seems to work by the release of endogenous opioids in the brain. Placebo antisteroidal anti-inflammatories does not. It seems to work by affecting cannabinoid receptors. So it's a complex, fascinating field, and what seems to happen is if you believe that something's going to happen, and if you've ever had an opiate, and I'm sure you've had an NSAID, you'll know you can feel the difference. And if you believe that something's going to happen in your experience, when you think it's going to happen, your brain does something that mimics what happens from the actual drug. And that's the kind of thing that we are looking at, and we have a long way to go. We are making strides. We know that there are two things that are involved. One is a person's beliefs and expectations. That's been very well demonstrated. And another is the therapeutic relationship. The relationship between a clinician and a client or patient, depending on the kind of setting it is, the better the therapeutic relationship. And we've actually been able to manipulate the therapeutic relationship in the placebo treatment of irritable bowel syndrome, and found that if we enhance the therapeutic relationship, we enhance the effectiveness of treatment, and we can get a placebo effect with a good therapeutic relationship that's as good as the best. They're usually things like probiotics and things and fiber treatments. They don't have very great treatments, and they acknowledge it. They're not defensive about it for irritable bowel syndrome. Yeah. Sunshine, yeah. I don't know. I haven't seen. There needs to be a lot more research done. You know, the drug companies do research on drugs. They're not interested in evaluating alternatives. Drugs. Clinical trials are expensive. The National Institute of Health and some charitable organizations will fund research. Their research winds up showing a lot smaller effect for drugs than the drug company research does, which I find interesting. But they will fund research, and they've funded some research into psychotherapy, but there is woefully little. Compared to the thousands and tens of thousands of patients who've been studied in drug trials. One of the things that we need education. We need people to understand how small the benefits are, how the risks, great the risks are, what the alternatives are, and we need financing for clinical trials into alternatives, and that would include things like Sunshine.
Question. How have your studies been received in England compared to this country?
Oh, that's an excellent question as well. You know, it's controversial everywhere. That's the first thing I have to acknowledge, and there is a strong controversy, but NICE, when they did their 2004 guidelines, they looked at the two meta-analyses that I had done at that point, and they considered that, and they considered other data of that sort, and they came to a conclusion, and their conclusion was that, especially for moderately depressed patients, drugs should not be the frontline treatment, and even for the very severely depressed patients, psychotherapy should be provided either as a complement or an alternative. And Lord Layard, who's a Lord, it's not his first name, is at the London School of Economics, did a cost-benefit analysis on antidepressants and psychotherapy, and figured out that in the long run, it would be cheaper to provide short-term psychotherapy for people who are depressed than to give them antidepressant medication that they're going to have to be maintained on maybe for the rest of their lives. And so the British government passed legislation voted for by both the Tories and the Labour Party. That's very unusual, isn't it? In which they established a program to train 10,000 new therapists dedicated to treating depression with psychotherapy for free through the National Health Service. The initial reports on those, very impressive and positive. If you see the entire, if you would like to see the entire 60 minutes segment, it's available both on YouTube and on the 60 Minutes CBS website. The YouTube one is, I think, a little easier. A couple steps you save, you click it on, it goes right on. And you will see there a discussion by someone from the National Health Service in the UK and his understanding of the research and the implication. Just put in Kirsch antidepressant. That'll do it. It'll come up very quick, very easily that way. Thank you all. And it's a pleasure being here. And I hope I'll see some of you in the panels later this evening.